We have with us the CEO of Mission Smile, Conrad. Welcome. And I would just like to know about this whole event that is happening here in Goa. How did it come about?
Okay, so let me give you a little bit of a brief on the genesis of Mission Smile. We started off in many years ago, and we've completed 45,000 smiles. We've screened 67,000 patients, and we are proud of gifting smiles to children from less privileged society, I would say. This event in Goa is more exciting because we're doing it with the help, with the funding, with the support of Colgate. We've done 2,195 surgeries across 10 states, and we title this Smiles for Life. So I'm very happy that Colgate has vested the confidence in us, and we've been able to gift so many smiles. What we call them smilestones, not milestones, and we're happy to carry on. Just to give you an idea of the enormity of the situation, 1 in 700 children in India is born with a cleft palate or a cleft lip. Every year, 35,000 children are born, and there is a 1 million backlog. So if we stop doing the good work we're doing, it's like rowing a boat upstream. You stop, you don't remain stationary, you just get pushed back. So thank you, Colgate, thank you, Wisdom Hospital, and thank each and every one of the patients who have come here, because of whom we're being able to do this little bit of good giving back. Thank you very much.
From what I understand, the patients who have come, they're coming from the underprivileged class, and you all have been taking care not only of the surgery but also of their food and stay. So could you just enlighten us at how did this whole thing come about?
Yeah, so what we do is, and what we are different as opposed to the others, is that we have what we call comprehensive compassionate cleft care. So when we find a patient, we take care of their travel, we take care of their stay, not only of them but the guardian, because they are small children, and we take care of their staying. There have been times when a patient wants to come but tells us that he is going to lose a day's wage, and then we say, don't worry, we'll reimburse you for even that. So we go to that extent, we go that extra mile to see that these children who can't afford to go to a private hospital and get this done, get the best care possible. It's a proud thing that all our surgeons come absolutely free of cost. They do operate honorarily, and the hospital gives their facilities absolutely gratis, and that's the way in which we are able to inch forward and tackle this problem.
Looking forward, if you have such a cooperation from hospitals coming in Goa, would you be in a position, or rather be able to extend this kind of help to more patients here?
We would love to. The only thing is we would need help, support from the government, from the National Health Mission, from the Health Ministry, to try and locate these patients. In Goa, what we find is there is an issue with locating the patients. So we'd be happy to do this. We'd be happy to come back again and again. We just need help with the recruitment. Rest is taken care of by us.
Thank you so much. We have with us the Field Medical Director, Dr. Sangram, with Mission Smiles. Welcome, Doctor.
Thank you.
Could you just please give us a rundown on how do you go about checking on the eligibility of the patients?
Okay. For this is basically, we don't have a bar for doing a surgery. The lower limit is more important than upper limit.
Okay.
We basically feel that once the child attains the age of at least 6 months and at least attains the age of 6 kgs of weight, the child is eligible to undergo the knife by taking all precautions into consideration. But the upper limit is not set. We have actually operate up to 70 years of age also we do cleft lip palate surgeries. But for doing these surgeries, the child has to go through a process of understanding that, what are the steps which needs to be treated and what stage what needs to be treated. That's more important, I would say. A lot of people believe that, you do one surgery, that surgery is done and for all, once for all. It's not once for all. Because a child is born with a multiple problem with a cleft patient's child, multiple problems, like a cleft lip, palate, then nose, a lot of complications are there with those things. So basically, through a life stage, they have to undergo at least 5 to 6 surgeries. 5 to 6 surgeries in different stages of life. This is what I'm talking if there is no complication during the whole process and everything goes as the required for the child.
Okay.
So first surgery starts at 6 months, I would say.
Okay. So it's a long duration.
Long duration. You need to keep a follow-up of these patients. That is why we develop a center called center model where missions will not be, we do those surgeries and we have a local surgeon who is there in that particular place who helps to ensure that the safety of the child is also taken once we finish the mission. So, but in any stage, we only able to do only one procedure out of 5 procedures which is need to be performed in a child.
Okay.
So that's how we screen and decide which procedure needs to be done at what age. The today's one of the case, the child has a cleft lip and a palate, but the child is already reached a stage of 2 years.
Okay.
In normal situation, I would love to do a lip first, then do the palate. But in this condition, I would love to do the palate first, then the lip.
Okay.
The logic behind this because child has already attained the stage of speech. So if you delay the process of surgery for the speech will not be really good. So it is good to pertain to the surgeries as early as possible. So the counseling starts from the child is known, the child is, in fact, nowadays with ultrasound we can actually determine the child is cleft or not.
Okay.
So the counseling of the mother is the first thing which we do from our in our cleft treatment.
So you say at quite an early stage you can detect that the
Yes, we can detect.
child has
yes,
this problem.
yes.
Okay, now for a common man who doesn't understand the cleft lip and the cleft palate, could you just define for a common man to understand what exactly this is?
Basically, this is a congenital disorder
Okay.
which is born, which happens with the birth. It is not like a lot of people have a belief that because of some eclipse or some karma or a lot of illusions are there. Our country is a lot of religious people.
It's a misconception.
Misconception, I would say.
Okay.
So it's basically congenital disorder. Now, to understand what is this congenital, why it happens to me, it can happen to anyone.
Okay.
But there are a lot of studies going on to find out why this is actually happening.
Okay.
So we have almost reached a condition saying that if the mother has not taken a folic acid during her pregnancy,
Okay.
then the chances of having a cleft child is very high. I would not say cleft child, a congenital abnormality, whether it's a cleft lip or any other abnormality for sure.
Okay.
Cleft lip also is a congenital. But having said that, genetic plays a role also. Then hereditary plays a role also.
So you mean to say to a large extent?
So yeah, other factors do
these
affect.
are
Other
factors.
factors. But we cannot specifically say this is the only reason why the child is having. It is not happening only in the developing countries. In developed countries do also have this cleft lip and palate problems.
Now coming back to the developed countries and India, what you all are doing here, Smiles,
Mission Smile.
Mission Smiles. You all are doing this free of charge. Doctor, even you have done a fantastic job by offering your services free of charge down here. For a normal person to have this kind of surgery out, how much would it cost?
I would say almost ₹1,00,000 will be spent if you are going to in a decent hospital because prices not depend on the surgeon only. Hospital, favorable factors, a lot of things change.
Okay.
But in an average, I would say it will cost roughly ₹1,00,000. Because here we are doing it complimentary, like my services are free, anybody's services who's
I was given
coming.
to understand, Doctor, there is a battery of doctors besides you who have offered this services.
Yes.
So I mean, it's a fantastic job, and especially you come down to Goa to do this, and not only offering Goan but people from other states. Really,
Yeah, actually in last couple of months, last 3 months, I have done a mission in Kerala. I did a mission in Shillong and now I'm here. In this 3 months span, I have done 3 missions all back-to-back missions.
Okay.
So basically it is, I have to give it back to the society,
Okay.
It's always, you can't take it. You have to give it back to the society.
Right.
And I know I am not able to give in form of money, but at least in the form of talent which I have. So that's the surgery which I am doing it free of cost at least.
And Doctor, lastly, for people who are viewing this, who don't know what's in store, what are the precautions or rather what are the red flags you would be looking out for during pregnancy or during birth? Could you just enlighten them and
Yes.
they shouldn't panic.
Panic,
So what are the
yes.
things that you would like to tell them?
See, I would say it's a bad luck to have a cleft lip and palate, but Having said that, if it's been diagnosed, don't say that there is no treatment for this. There is always a treatment.
Okay.
I would not say do a female feticide or a feticide for having a cleft child. So you can counsel the mothers. The child can have a normal life. So the counseling starts from there itself for us.
Okay.
But nothing to panic. There are a lot of centers who are doing it on day-to-day basis. I know. I worked in Hubli for quite a time. So a lot of people are doing this, and we are doing a great job. I hope we are able to reach the ground level and help the society.
We'd like to thank you, Doctor, for this endeavor and the kind gesture, you and your whole team. Thank you very much, Doctor.
Thank you. Thank you. My pleasure.
Yeah, we are glad to have Mr. Raghuram, who is from Colgate. And so, could you just tell us, like, how is your feelings to be associated with Smiles for Life?
I think it's a great feeling to get associated with this program and the Smiles for Meals. The fact is that both of us have a very common vision in terms of really seeing how do we help this key area where we can do this improvement. And I think it's a great occasion that we are able to partner this and we are able to do this countrywide. The proof of all of this is the huge number of surgeries that we've managed to do. I think we've done close to about 2,000, and that makes this milestone quite weighty enough. We're happy to partner further on this and take this to the next level.
Going forward, I mean, you'll have put a smile, literally put a smile on the lives of so many kids, the underprivileged. What is the next step that you're looking forward to?
See, as an oral care company, we've been putting a lot of effort in terms of whatever we can do, both in terms of products and more importantly, what we can do back to the community. And this is kind of very well displayed in terms of the different interventions that we're doing. This is the first level of program. We have a long-term plan in terms of how do we take this forward, and hopefully we'll see many things to come.
Lastly, I would like to ask you, the response that you see here in Goa, what's your take on that?
I think it's quite encouraging. It's quite encouraging to see a huge number of patients turning up, and more importantly, a huge number of doctors and volunteers turning up for this occasion. I know it's not easy, and most importantly, people have come from across the country. So we're extremely happy to partner on this program, and this entire support that's coming, it's quite encouraging. So we just wish to take this forward.
So lastly, I would like to say Colgate is not only touching your life, personal life, but actually reaching out to the underprivileged and changing lives forever. Thank you so much, sir.
Pleasure. Thank you.
Thank you.